Dr. Habib Sadeghi, who has given us the honor of sending us a video of 12 or 13 minutes and to present his work once again based on science and love. The love pins that you're wearing is from him. He's an extraordinary physician living in Palm Beach, and today he has a very large clinic which is known worldwide. Numerous celebrities are cared for there. But this has not removed him from his role of serving his patients. I'd like you to listen to a few minutes of the video clip. I wanted to show it tomorrow, but as we're more numerous today than tomorrow, I thought it'd be useful to show it today, and then we'll go on with the Ancestral Medicine panel with the outstanding speakers that we have. So happy listening, and then we'll continue with our initial program.
Dear friends, participants, welcome again to the second session of our Congress. Thank you very much for the video of Dr. Habib. Now allow me to introduce our next speaker for this session, Ms. Mali Klein. Ms. Klein, you have the floor.
Thank you. Can you hear me now? "30 seconds, no more." Not quite that much. Take the sound down. Well, it would have worked. In science, where there is a confrontation between evidence and opinion, evidence always wins. Not so with Essiac. Given the evidence of the 1939 Canadian Cancer Commission hearings in Toronto, the 1959-1960 Bruce Medical Center trials in Cambridge, Massachusetts, the 1974-76 trials conducted at the prestigious Sloan Kettering Institute for Cancer Research in New York, and the consequent failure of the Canadian Wald Barker trials in 1977, medical opinion states that Essiac has no merit, while the wealth of so-called anecdotal evidence continues to accumulate. Tumors disappeared. Blood work returned to normal. Tumors encapsulated and easily removed with minimal risk of metastases during surgery. Terminally sick patients living normal, fulfilling lives years beyond the prognosis date. Essiac is not a cure-all for cancer, but there were and are many people taking it who improve more than can be explained. The original formula, now known as Blackroot medicine, was created by an elderly Native American medicine man for an English woman with breast cancer in the summer of 1893. She was menopausal, the tumor was large and aggressive, and she and her husband were living in a mining camp on the Canadian frontier in northern Ontario. The doctors in Toronto recommended an immediate mastectomy with little hope of survival. The medicine man told her he could cure her without surgery. His formula consisted of 8 herbs, 2 of them native to North America, the rest arriving with the European settlers, together with the shredded inner bark of the slippery elm tree, he included the roots of Rumex acetosella, this plant, Arctium lapa, greater burdock, Rheum palmatum, turkey rhubarb, Trifolium pratense, red clover, Winca major, periwinkle, Rhodoper nasturtium aquaticum, watercress, and Coptis trifolia, variety Groenlandica, gold thread. I forgot to put that in. Native American medicine men and women were specialists rather than general practitioners, assembling their personal pharmacopoeia over lifetimes of practice, the details of which they were not obliged to reveal to their patients. This medicine man made the unprecedented move of not only offering to treat a white woman, but also naming the 8 herbs, showing her where to find them and how to prepare them. Mrs. Johnson kept the formula secret for another 30 years until 1922, when she shared it with Rene Caisse of Bracebridge, Ontario, who would use the formula as a basis to develop the cancer treatment commonly known under the blanket term Essiac, her family name spelt backwards. Rene was a dedicated, highly ambitious career nurse who was also strongly resentful of the male-dominated hierarchical medical profession of that time. Right from the start, she wanted to be recognized. She wanted to be involved. She wanted to work closely with the doctors, and the only way she could compel their cooperation was to keep the ingredients secret. Doctors could examine the results. They were not to share in the preparation of the material. And this is important in the story. Her initial results using the medicine man's formula were promising. Her aunt, terminally sick with liver cancer, made a full recovery. And in view of this and other successful treatments, a group of doctors in Toronto encouraged her to develop an injectable formula, experimenting on mice prepared with human carcinoma. To be clear, we are talking about 2 related but distinct categories of treatment here. The medicine man's original formula, now known as blackroot medicine, the 8 herbs, and what is now known as has become classic Essiac tea, the 4 herb formula, which is the most popular and most readily available today. Rene Caisse's Essiac, consisting of the Rumex acetosella decoction given by injection, plus a decoction of Arctium lapa, Ulmus rubra, and Rheum palmatum, diluted in hot water as a drink, that might also include Coptis trifolia and or Rhodoper nasturtium aquaticum at varying dosage levels for selected patients. Key to the success of this treatment was the Rumex acetosella injection, administered intramuscularly as close as possible to the site of the primary tumor. The few that were unable to tolerate the injection drank a version of the oral decoction consisting of not less than 35% Rumex acetosella root, what would become the basic 4-herb classic Essiac tea formula. It was only when Rene Caisse was no longer permitted to administer the injection that this formula became the basis of the Essiac remedy best known to us today. Dr. Stock's offer to test Essiac at the Sloan Kettering Institute was the dream ticket for Rene Caisse. It was the opportunity she had been praying for since the breakdown of the Bruges trials in 1960. What's more, this time she had a written guarantee that she would be recognized for her work if the testing succeeded. And she failed to honor it, for the same reasons that terminated the Bruges trials and would cause the Wald-Barker trials to end in failure. Her continuing refusal to supply recognizable, itemized material for testing. Anyone involved in research knows that it is not only unreasonable to be expected to responsibly analyze unknown substances from a questionable source, but also impossible to guarantee reliable results. The staff at the Bruges Medical Center had been obliged to operate blind, as was Dr. Merker at Sloan Kettering, who supplied the mice on condition that they were returned to him for analysis. Despite later claims to the contrary, Rene Caisse never revealed the identity of the herbs to Dr. Bruges, neither during the 10 months they were working together in 1959 to 1960, nor in the late 70s when the Essiac story was published in the Toronto Homemakers magazine and became more widely known. A year after her death, Dr. Bruges was recorded on tape telling Sheila Snow that he was waiting for instructions from Mary McPherson because he didn't know the combination for mixing the herbs or how to use them. Rene Caisse was more forthcoming with Dr. Stock. In a series of detailed letters, she assured him that he was the only person she had ever trusted concerning the identity and preparation of Rumex acetosella in decoction. When she mentioned in a letter of May 1974 that it took years to isolate Rumex acetosella as the herb that worked directly on the cancer cells, while the others were equally necessary when administered as an oral decoction to facilitate the resulting detoxification process, Dr. Stock requested fresh material along with the identity of the herbs related to the treatment. Of course, she refused, and the testing was discontinued. When he was interviewed for the magazine article a year later, he repeated that he was willing to continue the work if he could replicate her method where the injectable substance would be followed up with the ingredients to make the oral decoction. Again, she refused to cooperate. Cancer and Rumex acetosella have a lot in common. Like cancer, the plant can be difficult to eradicate, surviving fire, volcanic eruptions, prolonged periods of drought and freezing conditions. Like the disease it shows activity against, it survives repeated treatment with chemicals, and, given the right conditions, the seed can remain viable but dormant for many years. Like cancer, established colonies can occasionally vanish for no apparent reason. Of the 8 herbs, only Rumex acetosella proved injectable with no adverse side effects, exhibiting activity not only directly against live cancer cells, but also where metastasized cells appeared to revert to the primary tumor before the mass broke down. 50 years later, Dr. Stock remarked to Sheila Snow that Dr. Merker had observed similar activity in the Bruche samples in 1959. In practice, I have only once observed what appeared to be the same activity. That was where, including the yellow cottage cheese type discharge as the tumor broke down. And that was employing a full range of 5 formulae in which the Rumex acetosella content consisted of 100% root, as in blackroot medicine. The 4-herb classic Essiac tea and its 2 derivatives, Essiac clover, including Trifolium pratense, Essiac gold, including Coptis trifolia, plus Essiac topical solution as 1 part Ulmus rubra bark to 5 parts Rumex acetosella root. Personally, I haven't harvested the leaves and stems of the plant, nor used them since 2009. Sheila Snow first proposed introducing Trifolium pratense into Essiac when we were writing our first book together in 1998, and I have continued experimenting with the herb, using the roots in preference to the flowers, which are generally easily commercially available. The lineage. A 19th century medicine man who may not have been able to read or write, yet accomplished something his white contemporaries couldn't hope to achieve. The Englishwoman he cured an aggressive breast cancer. It's a great story, but it's not romantic hearsay, it's fact. She survived and lived 30 years longer into a ripe old age. Nurse Rene Caisse, courageous but flawed, who threatened to take the secret of Essiac and blackroot medicine with her to the grave. She would have succeeded, if not for the tireless efforts of Mary Macpherson and Sheila Snow, who worked with her during her final years, making copies of all the paperwork and letters she allowed them to read, memorizing the information she permitted them to share, Sheila taping hours of telephone conversations after the magazine article was published in 1977. One handwritten paper entrusted to Mary Macpherson, a collection of letters entrusted to Dr. Stock, plus one chance meeting between Sheila Snow and a man who had harvested the mysterious 8th herb for Nurse Caisse during the Bracebridge Clinic days. And we had it. The original formula, plus confirmation of the activity of Rumex acetosella root in cancer cells. Rumex acetosella has been recorded as being present in 71 of the world's 195 countries, covering a vast amount of habitable territory, either as a native or introduced species, where it was followed by many of the plants the medicine man selected to include in his formula. Ancestral medicine cannot be patented. The knowledge is out there, the birthright of what it is to be human and survive. Essiac cannot be patented. The formulae are well known, and when they are prepared following the accepted procedures and taken at the correct dosage levels, they are generally well tolerated when used in conjunction with conventional and alternative therapies, including radiotherapy, steroid drugs, and chemotherapy. Most importantly, Essiac is something cancer patients can choose to make for themselves in the privacy of their own homes, taking back their power and right of decision in the wake of a devastating diagnosis. No one can stop anyone picking a few herbs and turning it into a tea. Dr. John Barker left with no alternative but to join Dr. Wald in publishing a negative report at the conclusion of the 1977 trials, told Sheila Snow on tape, "I think that old Essiac did work. We haven't established the uselessness of Essiac, just the uselessness in terminal patients of the material Rene Caisse is producing now that she calls Essiac. It means it won't be easy to get research funds to direct towards Essiac for re-examination, but this doesn't prevent people from testing herbal remedies. There will be a resurgence of interest. I'm not pessimistic about the long view for Essiac. Current research into the properties of the medicine man's herbs indicate activity in all 8 of them. And after 26 years, growing the plants, making and taking the various formulae, studying the evidence in the archive material, I agree with Dr. Barker. I think old Essiac did work. Preventing metastasis remains one of the biggest problems in cancer treatment today. Science may not be always entirely objective, but it is generally considered to be democratic and intolerant of dishonesty. What if the action of Rumex acetosella against cancer could be proven in the laboratory, using spring and autumn samples collected from selected places around the world? What if the apparent action whereby metastasized cells return to the primary tumor could be proven? What if a substance could be isolated from the material that would incorporate these properties? What if that substance could be injected prior to surgery, during surgery, and post-surgery as a follow-up treatment to minimize the spread of metastases? There may yet be a place for Rumex acetosella in 21st century cancer treatment. Thank you very much.
Ms. Klein, thank you very much for your presentation. Now, I have the pleasure to invite Dr. Shan from France. Dr. Shan, both physician, professor, author, and speaker. Dr. Shan, you have the floor.
Hello to everyone. I'm going to make my presentation in French. The slides will be in English, which means that you'll be able to follow the presentation. I would like to thank the organizers of this conference for their kind invitation. It's very difficult to start from almost nothing, and this is a very important topic. So thank you. And thank you for giving me the possibility of speaking in this category entitled Ancestral Medicines. Cancer, indeed, is a disease that has existed since the beginning of humanity, a very old illness, and the 1,000-year-old traditional Chinese medicine's view, like other traditional medicines, and we will talk about Ayurveda in a few moments, this old disease is something that deserves to be remembered. However old it may be, traditional Chinese medicine is an original, benevolent, and unique perspective, capable of offering new therapeutic and prophylactic perspectives on cancer, which seems to have experienced an increase in growth proportional to the process of civilization. A process that has certainly allowed us to live longer and better, but has also led us to become more fragile and weakened. So, to understand the traditional Chinese medical approach to cancer and its treatments, it is necessary to understand the vision that this medicine has of human life, because the vision is different depending on the medicine. As a background to these issues, let us remember that, firstly, life does not belong to us in traditional Chinese medicine. We belong to life. That's a big difference. We are breathing the same air together. We are sharing the air that we breathe. We absorb air that comes from the sky. And what we ate over lunch comes from the earth. It is our blood. The heart pulsations are also proper to the earth, the earth's songs. So we're like a baby, and these two rhythms keep us in life. We belong to life. If we think that life does not belong to us, we should stop breathing for a few moments, and then we will see what happens. So this is a first fact that we need to keep in mind when we talk about living being. Another important point is that there are various ways of understanding life that are scientific, just as scientific as others, but there are different sciences looking at the living world in a specific way. An older professor of internal medicine said to me, there is two ways that you can understand life. You can lock yourself in a laboratory and glue your eyes to a microscope, or you can go outside and open your eyes. These two visions are right, and both are very interesting in their own way, but they do not lead to the same medical approaches and the same conclusions. Hippocratic medicine, contemporary with Chinese medicine, is not the same as Pasteur's medicine. And when we use that expression, which is something we often hear in France, we seem to omit the fact that Pasteur was not a doctor. He was a biologist, which is not quite the same thing. Third important element, traditional Chinese medicine, and not only Chinese medicine, as Dr. Sadeghi said in the video clip a few moments ago, well, traditional Chinese medicine and traditional medicines establish a permanent analogy between human beings and the nature to which they belong. Our body can be seen as a landscape, and our ships, our rivers, our emotions, our climates. Climates as well, the emotions. And in traditional medicine, one compares the functioning of the human organism to that of a country, and the functioning of vital organs to the functioning of a government managing the country. And the planet can be seen as a living being as well, which is its tremors and its hot flushes. And it's got temperature right now, a high temperature. So it is from these naturalistic, global, and analogical visions that I suggest that you take a moment to look at cancer and its treatment in traditional Chinese medicine. My Master of Medicine, Professor Leung Kok Yuen, once said to me, suppose you come home from a vacation one day and you find mushrooms on the walls inside the house. You have two possible types of reactions. You can say, oh, mushrooms. and you take an interest in them. You start counting them, measuring them, sampling them, biopsies in a way, and to determine what type of mushrooms they are, and developing treatments to poison them, such as chemotherapy, burn them. So in cancer, this would be the radiotherapy. To burn them, to poison them would be chemotherapy, to scrape them off would be surgery, and then continue the treatment subsequently, because the fungi, mushrooms will return. Or you can react differently. You can say, oh, there's too much humidity in this house. The climate is not normal. The air doesn't circulate. You don't really worry too much about the type of mushroom. And in this case, your reflex will be to open shutters and windows to let in air and light, to turn the internal climate of your house, and the microorganisms will change accordingly, because we belong to life. If the number of mushrooms is sufficiently large, to create its own internal microclimate, you need, of course, to look into the matter. But you can cleanse on the one hand and rehabilitate on the other. But if you simply poison them, such as in chemotherapy, well, of course, these are treatments that are really short-term, because we know full well that the mushrooms will reappear at some stage. And it's the same way as the illness returns. Whereas if you can clean and rehabilitate the room, the mushrooms will disappear. So these two approaches are not incompatible. And I let you guess which is better in terms of prevention and treatment in the long term. Another important consideration in Chinese medicine is the origin of the cancer process. It can be endogenous or exogenous of illnesses, and in our case, the cancer process. There are two very different origins, in fact. Some cancers are due to aggression by external factors, such as chemicals or radiation, that have mutagenic effects on the body's cellular intelligence. The body has its own intelligence, called Po in Chinese. It maintains a cellular intelligence, a field inside the body, from pesticides to 5G. Welcome to 5G. And genetic manipulation, or even certain drugs. Currently, there's a great discussion relating to the proliferation of brain tumors following the intake of androcur medication. Our modern society, through this quote-unquote progress, is a major provider of these exogenous causes of cancer. And we see this in statistics in terms of the evolution of cancer. This is one global category of exogenous causes of cancer. I saw a patient recently who actually worked in a submarine, but it's as if he worked in a microwave oven. He didn't have a cancer, but he suffered radiation throughout his career. There are other forms of cancer that are due to internal metabolic disorganization. So it's a self-poisoning, a kind of civil war. You talk very often about autoimmune illnesses, so it's a kind of civil war within the body that generates a cellular degeneration without the intervention of exogenous factors. These types of cancers are most often caused by emotional disturbances. Emotions are energy, overwork, disease, or age, which generate decreases in immunity, giving free rein to uncontrolled cell proliferation.
Et qui laisse des plantes parasites s'installer en lui. Quand le maître n'est pas clairvoyant, les 12 organes sont en danger, dit un texte de médecine chinoise qui remonte à 300 avant Jésus-Christ. Ce texte explique comment certains types de chocs émotionnels peuvent provoquer certains types de cancers. On est en 300 avant Jésus-Christ.
This is in 300 BC, how some emotions in certain contexts generate certain cancers. Today, we are still holding oncological symposium to know if emotions need to be taken into account in tumoral processes. You can see the time that's being wasted simply through lack of memory. So the major difference that has to be established between these two initial sources, which are very different because they don't produce the same prevention nor the same therapeutic logics. Hippocrates was saying, illness is not more important than the patient. And this has been repeated in many ways over these past 2 days. There's no point dying healthy. And that's why the logic of having systematic war against cancer cells, but without taking into account the bearer, is not the best way to treat this illness, but leads to very strange statistics where you can be very proud of 10% of therapeutic progress over cancer in a few decades, and at the same time, 40% more cancers. It seems that we're not looking in the right slot. You need to have a broader vision, a more diplomatic approach, a greater will of dealing with the prime causes, even if this re-questions our lifestyle, our consumption, our behaviors, our thinking. And that may be the problem, which is in fact societal cancer. To give you an idea of this unconscious cancerogenesis that we generate through our health systems, 3 photos that I took in the French streets a few years ago. If I can get them up. Here we are. It says, breast cancer, it's not because you don't feel anything that you don't have anything. Advertisement in a bus stop. It's not because you don't have any symptoms, you don't have anything. I don't know if you know Dr. Knock by Jules Romain, but is it? Any healthy person is a patient that doesn't know it. But it's perverse, because what does the subconscious say? If I feel well, if I don't feel anything, I have no symptoms, it means I probably do have something, maybe a cancer. And when you know the effect of concern and worry, which has been studied in a long time in Chinese health, look at anger, blood vessels swell up. Fear, you can suddenly have incontinence. A very powerful emotion, you can see effect on the physiology. Imagine these emotions that are held up inside like a pressure cooker without a safety valve. When you know these concerns of anxiety and stress, this is a campaign that is precisely creating what it's trying to fight, which is rather frightening. Second example. I'm alive, but so's my cancer. You may note the happy face on the patient. She has a melanoma, and she is only thinking about the fact that she's condemned. She's in death row. Fear, sadness are emotions that also have an impact on physiology and the tumoral processes which reduce immune defenses. Advertisement like this may be effective in terms of fundraising. That might be possible because fear sells, but shows total ignorance in terms of therapeutic research. A third, for the fun of it, if I may say, that's the same one. Oh no, here we are. Don't worry, it's cancer. It's supposed to be humorous to say that thanks to research and the money that's going to be given to research, that tomorrow cancer will be cared for just like a simple cold. Even if insofar as one can treat a benign cold. Well, any psychologist knows that the subconscious doesn't retain negation. Don't think of a polar bear. What do? You think of a polar bear. So don't worry, it's not a cancer. Then you see this in posters in the street, your subconscious concern cancer or worry cancer. That's the whole issue of hypnosis. You have to be very careful how you express something because negation is not retained. I don't care if people say good or bad about me as long as they talk about me. So don't worry, it's cancer is an additional chance of getting a cancer. I'll stop there for the examples, but you can understand that the ignorance of emotions on human pathology, and these are emotions, there could be other causes, but is one of the dramas that exist in today's world. Placebo and nocebo are not handicaps for scientific evaluation of treatment, but are powerful motors in the human forces, positive or negative, and they have to be taken into account in the whole process of illness, treatment, and especially in the field of cancer. Relating to 300 years BC, after being exposed to the impact of emotions on certain illnesses, which says that if the physician doesn't have enough authority to distract the patient, none of medicine will be effective, and the art of the physician who doesn't know this. So what is the quality of a physician who doesn't know that there's several aspects in a human being? So one example amongst many others that shows how medical research and the present policy in the fight against cancer should deserve or would deserve more opening and humility, curiosity vis-a-vis what traditional medicine, like Chinese traditional medicine, is not the only one, can contribute to the general debate. There is another approach which could be interesting, of looking at therapeutic protocols in vis-a-vis cancer, and which usually leave aside individual specificities of taken to Chinese, and if the treatment is identical over time, is fine for the pharmaceutical industry because you produce a pill and adapt people to the pills. It facilitates randomized research, but also excludes the patient from his illness and is far from preventing relapse. Another theme which could have been of interest on the Chinese vision of life, the civilizational aspect of cancer, an illness which seems to strike humans the further they move away from nature and behave vis-a-vis a cancer vis-a-vis Earth. We could also have looked at the fact that it's an illusion to try and treat certain illnesses if you don't like people, or if you don't like yourself. In Chinese medicine, there are two hearts, a pump that somebody's already referred to, and churches, there's also a lamp. And all this works together. So I'm not going to do too many themes in one shot, but my old professor said that rush is one of the unhealthy situations that encourages cancer. So you can understand that these are themes. Each of the themes deserve a congress to themselves. And this simply to say thank you. And just a last comment. In China, even if China has changed a great deal with cultural revolution because of imperial medicine, and it was forbidden for some time before being reintroduced, slightly changed, because now it is trying to accept the Western standards of medicine, but it's becoming hard to prove that a medication is effective on 10,000 people if you need to modify it for each patient. But in China, at least, it is quite blatant that medicine is integrative. That is, Western medicine, which has been formed on battlefields, knows how to attack harmful cells but it's also good to have medicine that avoids a patient from dying healthy. And we simply should hope that thanks to the ethno-medicines that exist on this earth, that we enable Hippocrates to find his place beside Pasteur. Thank you.
Thank you, Dr. Shan, for your presentation. Our next speaker is Dr. Soni. He's a young doctor in his 30s, devoting his life to assist people in their path towards felicity, happiness, and life. Dr. Soni, the floor is yours.
Namaste from India and good afternoon. I'm very thankful for this opportunity, especially thankful to Shima. So I'm here to present Ayurveda. So maybe some people already knew little bit about Ayurveda, or it's maybe not. So I will speak something about Ayurveda. So generally the term Ayurveda, it means the science of life. So it's one of the most ancient holistic healing system. Still it's present. It's we can say like it's almost 6 or 7,000 years old science, which has come across from all the time. It's to make sure like it's still we can have some kind of benefits from it. So as you can see, it's not only a medicine, but it's a lifestyle. Not only lifestyle, but it's a science, art, and lifestyle. So why science? Because it's a time-tested knowledge. Art, because the applications and the possibilities are infinite. And philosophy, I'm little nervous. So it's as a philosophy because it's also a lifestyle. So in Ayurveda, we speak about harmonizing the body and the mind. So as you can see, like it's how we point out. This is the point. This one, the red one. So as you can see, it's a complete medicine. Like we have 8 different branches. It's all written in Sanskrit, but I will say it in English. So the first one, Kaya Chikitsa, it's a general medicine. Then the Bal Chikitsa, it's a pediatrics, gynecology, and obstetrics. Then Shalya, it's surgery. The Visha, it's toxicology. It's then Graha, it's psychiatry. Shalakya, it's ENT and cephalic diseases. And Rasayana, it's rejuvenation. And the last one, the Vajikarna, it's aphrodisiac. So for mostly people, it's Ayurveda. It's something like it's a mythical or some kind of magical or some it's not only for Ayurveda, but all the ancient medicines or ancient systems are considered like it's some kind of magic or something like it's coming like from nowhere. But just I want to make sure it's to make all people understand like it's not only that. So from decades, or it's not only decades, but from centuries, we are working on the principle, and it was a complete medical system. It's who are able to heal or treat every kind of disorders coming from anywhere. But for sure, it's recently it's not being practiced as it was. So in Ayurveda, we say like everything is made up of 5 elements. So as you can see, it's like the fire, air, space, earth, and water. So everything, it's me, it's a person sitting here, it's you, or whatever we can see, it's made up of the 5 elements. Just everything look different because of just different compositions. If we can see, it's in the history of all the medicines, they all speak the same. They all speak about everything. It's coming from different elements. For sure, some can say it's 3, some can say it's 4, but the basic knowledge is always same. So in Ayurveda, we have 3 main principles. So as you can see, it's called doshas, or we also call it as humors. The first one is vata, the second is pitta, and the third one is kapha. So as you can see, also location of them, it's a vata, it's located in the pelvic region. The pitta, it's more in the, it's not accurate image, it's more in the small intestine. The kapha, it's more in the lungs. It doesn't mean like it's located only there. It's located all over the body, but they are the main sides of it. So as you can see, it's even vata, it's made up of ether and air. Again, like ether means space and air. Pitta of fire, and the Kapha of water and earth. So, in very simple words, it's a Vata is it's a movement of it's a principle of movement. The Pitta it's a principle of transformation, and the Kapha it's a principle of cohesion and protection. So maybe it's not very easy for all people to understand. So I will say it in very simple words. Vata is just like electricity. Pitta is like oven, and Kapha is like fridge. But without electricity, neither oven works, neither fridge works. So Vata is just like life force. So our body is made up of all three, but for most of the people, two are more predominant. We call it as the constitution. So I will come back to the back slide after. Okay. So each person it's made up of, as I say, it's all three, but it's two are more predominant. So most of the people we are having 6 different kind of constitutions. As you can see, it's I represent them with some special images to say it's all people they are different. So yes, so it's the constitution is something which is determined at the time of conception, and it never changes throughout the life. It's our identity unique. So each person is born with some specific identity. We can't say like it's each person is same. Each person is very different. So to understand it better, I will give example. For example, I have a fever, she has a fever, or you have a fever. So the line of treatment in Ayurveda is completely different for each person. It's like a tailor-made program for each individual. But irrespective of the constitution, the Vata, Pitta, Kapha, as you can see, they change according to the seasons, according to the age, and according to the timing of the day. So generally in India we have 6 seasons, but it's for sure in Europe we have only 4. So I just improvised according to the European standards. So in spring the Kapha is predominant, in autumn it's Vata is predominant, and in winter it's Pitta is predominant. So also it changes according to the age. Kapha is predominant from 0 to 16. It's a time when we grow. Then Pitta gets stronger from 16 to 40 or 50. It's a time when we build or achieve something in life. And after Vata gets stronger after 40 or 50, which signifies whatever we have built or achieved slowly start to destroy. So also it changes according to the timing of the day. Kapha is stronger from 6 to 10 in the morning and 6 to 10 in the evening. Pitta is stronger from 10 a.m. to 2 a.m. 10 p.m. to 2 a.m. and 10 a.m. to 2 p.m. Vata from 2 to 6 in the morning and 2 to 6 in the evening. So I will just give a little example to explain how it works. For example, people having insomnia, they always find it difficult to sleep. It's between 2 to 6 because it's a Vata time. It's too much agitation. But when it comes like around 6 in the morning, or like it's in the morning, especially from 6 to 10, they can sleep very well. So it's explained very well like it's this principle it exists. So generally this is the normal cycle of life. And as you can see, like I also quoted, in 2017 the Nobel Prize for the biology was given to the 3 scientists who speak about the circadian rhythm, which speaks exactly similar like the doshas or Vata, Pitta, Kapha and how they change, but just in the very beginning level, because still they have to go a lot to understand how it works. So as I said, like this is a normal cycle of life. So when it gets disturbed, all the problem comes. So for the moment, it's very difficult to have very good health because of the seasons. So as you can know, like the seasons are not the same. It starts to be cold in the summer, it starts to be hot in the winter. So because of that, no one is in good health. But we can't blame anyone because it's us who made the problem by ourselves. So yes, it's coming back to this. As you can see, it's like there are 6 main constitutions. So each person is different. For sure, it's like a person of Vata Pitta constitutions, they will have similarities in other Vata Pitta person, but still they are all unique. So as you can see, each person should be treated according to who she or he is, not what he or she has. So I would like to present also the new view on cancer. So generally the main aims of Ayurveda. So first thing is prevention. So it's very important topic for all of us, because generally it's being human, we do nothing for prevention. So why it's like this? Because all people, they have a car. I will just give example. When we buy the car, they make us sign a papers. Okay, you have to bring it certain time to make a certain revision. If you don't, the warranty is void. You will have no warranty. but we don't think about human body, which is more complex machine than a car. Because if something goes wrong for the car, for sure we can replace the spare part. But when something goes wrong for the body, we can't replace. For sure, there are like it's a different kind of techniques now. It's people like it's transplantation or different things, but still it's not the same. The survival rate, it's not like it's very very high, and it's not like something it's we can say like it's for sure we should go for it. So for prevention we do nothing. We always wait for some kind of trouble to come. So in Ayurveda we always speak about prevention. It's very important, and it's for that it's as I say like it's not only a medicine, it's also a lifestyle. So for sure lifestyle is very very important to make sure we can prevent any kind of disorder. So with the help of Ayurveda, I can like I will not say like 100%, but I'm like more than 99% sure like we can prevent everything. Just it's to say like I worked with some doctors who are working in Ayurveda for very very long time, and who have very great experience. So we have managed to make HIV positive patients to HIV negative, which is still not possible in any kind of medicine. For sure it has been not like it's a very big it's not like it's very big breakthrough, because we could not make it as per the standards of the modern science, because we made it like only 3 or 4 patients out of 50 or 60 patients we took to do the treatments or 2 different things, but over a period of 6 or 7 years. So for sure it was very a long time consuming and things, and it's still we can't prove it like this, but for sure prevention it works very good. The second line the second thing is curative. So it's similar like it's all the principle of medicines are like it's either it's allopathy, either homeopathy or other things, or even the Chinese medicine. So for sure there are different definition of cancer, or we can speak in a very different way, but in a very simple definition of cancer we can say like it's a disease in which the new life starts to grow inside us when we suppress the life within us. It's very simple thing, but it's a very big thing. So I'm not going to speak a lot about how we suppress life, because it's very like it's especially the stress. We can speak about the stress. We can speak about stress like it's non-stop, and we can say too many things. It's never ending. So I will say like it's one very important thing like it's when we like about the suppression of life. So there is a big thing like it's the biggest like suppression in our life, like it's when we are not satisfied with what we have. We are always having a conflict between what we want and what we have in life. Sorry, I have to rush. So it's the definition of health. The definition of health as given by WHO. It's the same definition what we are following in Ayurveda for more than 2,000 years. We don't only speak about it's like some kind of as you can see its image, like everything has to be balanced. Either it's body, either it's mind, either it's spirit. So I want to present something like it's a new view on cancer. So especially the first question is that the global or local. So global or local, it means I'm talking about the body. So whenever anyone is having cancer, so we always have to see it's either we have to do a local approach like it's anyone having breast cancer. So we just have to focus on the breast, or we have to see the whole body and the mind also. So why it's important? Because it's very important to understand like the body doesn't work alone, or in a single cells doesn't work like it's in this disruption. Everything works in harmony. So as other people also said, like for sure there is like it's a communication between the cells, even either it's a cancer cell or either it's healthy cells. So for sure it's very important like we should treat the body globally, not only to work on a specific part, either it's liver or either it's lungs or either anything. The second question is that to reinforce or to weaken. So generally all the treatments, the cancer treatment, either it's chemotherapy, either radiotherapy or whatever other different kind of treatments are done, it's always to weaken the system. Because for sure it's when the cancer cell gets weakened or they are dead, it's more easy to get rid of the disease. But it's very important like we have to talk about the immune system. Because for sure when our immune system is working in a good way, we can always fight the cancer. Because some people they say like we have always cancer cells, but for sure we never get cancer easily because our immune system is always working. So the next thing, the mind or the body. we have to just treat the body, or we have to do something about the mind also. So for sure, there have been a lot of researches, a lot of different talks about like it. So we have to do like either yoga or either different kind of treatments, like it's either music or even aromatherapy or different things. So for sure, it's we can say like it's the manifestation of the body of the cancer lies in the body, like the physical manifestation, but it also has the emotional reason. Because until we don't understand the emotional reasons, as it's all the people they have spoken before me, we can't treat it completely. Because for sure we can treat it, but it always come back. The last one is the cause or the symptoms. Either we have to treat the symptoms, like it's if I get a cancer of its lungs, so just I have to focus it to work on lungs, or also we have to focus like what is the cause, why the cancer comes. So these are the questions I think we have to work on. So one of the very important aspect in Ayurveda, the 4 triads. So Chikitsa Pada means the 4 limbs which are the 4 factors which are needed for a successful treatment. So as you can see, the first thing is doctor, the second is the medicine, the third is the environment and the care, and the fourth is the patient. So I think it's in most of the medicines now, the 4 factors they are missing. So when the doctor is good, then sometimes medicine is not good. When medicine is also good, sometimes environment and the people who has to take care, especially the nursing staff or the people, or it's especially the family, they are not very supportive. And you can see the patient is the last one. So for sure, it's when all 3 are good and the patient also is good, the success of the treatment is 100%. We can't speak, I don't want to speak only about the cancer, but any kind of disease which has been, like it said, like deadly and there is no cure, for sure it's curable when all the factors are working good. So now speaking about the different approaches in Ayurveda, it's how we treat diseases and how we see things. So first thing is Panchakarma. So I will speak very quickly about it. So my specialization is also in this field, the Panchakarma. Panchakarma, it's a process of 5 different therapies which aims to purify the body and the mind. So I will not claim like we can treat every disease, but for sure it's whatever the diseases or troubles which are not being able to be fine from any other treatments, we try to make better with it. The second thing about it's the lifestyle, education and prevention. So already we speak about prevention. I will just give a very small example about lifestyle. So there is something like mostly especially in Western countries, it's a big culture, like always taking shower or bath after eating, after dinner, and also for children they always give a shower in the evening, and always it's after some snack or something. So it's very wrong concept. I'm very surprised, like it's no other medicine or science they speak about it, because whenever we take shower after eating, even after 1 hour or later, it always makes sure the digestive system gets bad. Because why it is like this? Because in Ayurveda we say like it's 99.9% troubles, they start in our digestive system. Everything it starts here. So if our digestion is good, everything is good. So generally it's when we take shower after, sorry, I will do quickly. So generally it's when we take shower after eating, it disturbs our metabolism. And for sure when the metabolism gets disturbed, all the troubles start to come. For sure we don't feel the trouble very quickly, but with time, little by little, the problem comes. So I just want to say something, just to give example, because as I say, each person is unique, because we have a different constitution. For sure, like when we do some bad habits, we don't feel a problem very quickly. For example, like if you are used to eat something, it's bad for your health, even poison, little by little, over time you get used to it, but it doesn't mean it's your body like it. Because a snake which is born with the poison, it's like its identity, the poison. But sometimes even a snake can die of poison in summer. So you can see like the poison can kill even the snake. So for sure it can kill us also. So going to the next point, it's early diagnostic and pulse reading. So generally in Ayurveda, as I say, it's one of the oldest system of treatment. So we were not having any kind of scans or any kind of radiology or different things. So all the treatments or all the diagnoses were done by the pulse. So with the help of pulse, we can able to know the diseases which are going to happen even in 5 years. I can also see the pulse. I am not very expert. So the people who are very expert, they can even tell you what you have eaten 10 days ago or 10 years ago. It's not a magic, it's a science. And generally it's speaking about, again, it's a pulse reading. It works on 3M: music, meditation, and mathematics. Any person knowing these things, they can do the pulse reading easily. So the last thing, it's the healthy body in a healthy mind. It's not a healthy mind in a healthy body. When our mind is healthy, for sure the body is healthy. So I will speak quickly to finish. So in Ayurvedic pharmacopoeia, we have like almost like 1,200 to 1,500 plants which has been used for more than 3,000 years to treat different kind of troubles. So I want to speak, it's not about it's what we do, it's I just want to speak what are commonly misused. So the first thing is turmeric. It's a wonder drug in West now. So generally it's and most of the people, wherever I go, they use it in a very wrong way. So turmeric, even if you ask like it's a common man, or especially woman in India who has no education and nothing, they can tell you how to use it. We never use turmeric when it's fresh. But generally it's here, in Europe, you can find like fresh roots, and people, they either make smoothies or it's different kind of things. Even they cook with the fresh roots. So turmeric, it has some kind of alkaloids which are very bad for health. So for sure, whenever we take it, it helps. But we have to always understand we are bringing something good at what cost. The cost is always important. So generally the turmeric should always be used in powder and always in cooking, because there is also a trend of turmeric and pepper. So people wants to use the turmeric and pepper like sprinkling on the food. Again, so generally the turmeric, it's in India, how we use it. When we get the roots, we boil it in water for 3-4 times, and we just change the water every time. Then after, we don't use it directly. We dry it, then we make the powder, and we always make sure we always cook it with oil or ghee or any kind of fat to make sure it gets absorbed, like it's absorbed in the body without making any kind of troubles. So same thing, it's when we use turmeric and pepper in our food, it helps for the absorption for sure, but at the cost of your porosity of intestines. So anyone wants to make intestine porous, they can eat turmeric and pepper like this. For sure, we feel the problem, but not in a good time. The second thing is lemon. So this is also, it's a big, like lemon, it's like a champion of cancer treatment in a lot of researches we see in internet. So all the people, they say, oh, your body should be alkaline. In the alkaline body, the cancer cells can't exist. So this is also a very wrong concept, because lemon should not be used every day and not for each person. Because it's a very famous saying in Ayurveda, we say a medicine for someone can be poison for someone else. So same thing for ginger. The ginger, it's a wonder drug, it's being used now. So ginger, it's in Ayurveda, we don't have the same name. The dry ginger is very different and the wet ginger is different. So people also have used to drink ginger, lemon, honey. It's also a very common trend. So generally ginger should be used in powder also, because the properties of ginger, it's completely different. For example, when you have stomach ulcers, the fresh ginger, it's a poison. But the same thing, when you have a stomach ulcers, the dry ginger, it's a medicine. So it's another plant, it's Moringa oleifera. It's also it's getting its presence in the world, like it's people, they are using it as a super antioxidant. The same thing. So the main question is that it's when to use something, how to use, and to whom. Because until we don't understand it's how the things can be used, it's always it's the knowledge, it's not being diffused properly. So it's the same thing I want to speak about honey. So honey, it's also it's being like it's a daily lifestyle for especially European countries. So again, it's speaking about honey, we say like it's whenever we use honey, it's more than 43 degrees, like it's any kind of cakes, pastries, biscuits made up of honey, it's a toxic. All the toxins made by like such kind of honey, it's almost impossible to digest and to eliminate from the body. But as you can know, like it's because of the botulinum, there is always a pasteurization of honey. So for sure we are safe from like botulinum, but the toxins made by this pasteurized honey, we are going to pay for it for all the life. So for sure, like this, there are too many things, but I can't speak everything. So just I will conclude. So it's for sure I didn't present too many guidelines, but it's just to say like it's some guidelines from the time-tested knowledge of Ayurveda regarding the lifestyle, food habits, and attitude changes can bring remarkable differences in pre, during, and post-cancer management, irrespective of the approaches chosen to cure it. We never say in Ayurveda like, oh, come to Ayurveda or do this or that, because it's the most important thing. We have to understand in cancer treatment or any kind of treatment, it's to bring back the hope and belief in the patient. Without hope and belief, no treatment or no remedy can work, and this is the most important thing. So it's the same thing. I would like to conclude with that. Like it is the need of the hour to use the modern technology to explore the relevance of Ayurvedic concepts, so they may be interpreted in the light of contemporary scientific language to offer modern healthcare. Thank you.
Thank you very much, Dr. Soni, for your presentation. Now I invite Sima to provide us some information. Sima?
Thank you, Fanny. Since we are out of time, I'm really sorry about this delay, but I would like to know who is going to RTM Center. Please subscribe yourself in here because they're waiting for you, and I would like to know how many people are going. Yeah, okay. 5, okay, 6, 7, okay. So I'm going to announce 6 to 10 people going, and we'll see how this works so they can wait for us and receive us. Okay, thank you very much. And I think there is a switch between the presentation of Dr. Jaladat and Dr. Habibi, because we couldn't run it today, so that's why we switch it. And tomorrow you're going to have a presentation about traditional Persian medicine from a professor who's working with Shiraz University. He is just amazing, this person, and I hope you enjoy it tomorrow. Thank you very much. I give the panel to you, Fanny.
Thank you very much, Sima. Now we will have a coffee break, and then we will continue in around half an hour, for our research in integrative oncology. Thank you very much.
Processing is very important. Processing means